Imagine a world overwhelmed by fear and uncertainty. This is the reality we face during an epidemic. Today, we delve into how history informs our views on medicine and viral outbreaks. Throughout history, pandemics have significantly affected societies. From the 1918 influenza outbreak to the 1518 dancing plague, each event reveals crucial lessons about our reactions. These comparisons are vital for addressing the current challenges posed by COVID-19. First, let's examine the 1918 influenza pandemic. It spread globally, infecting 1/3 of the world's population. People donned masks, similar to today, while public gatherings faced limitations. Governments struggled to manage the virus. Next, consider the 1518 dancing plague in Strasbourg. Hundreds moved uncontrollably for days. Today, we would analyze this phenomenon through psychology and social pressures. Back then, it incited fear and led to strange reactions, demonstrating how our behavior influences epidemics. Now, let's link these historic outbreaks to COVID-19. Like the 1918 flu, fear and false information spread swiftly. Authorities enforced lockdowns and emphasized hygiene. Social media significantly influenced the dissemination of both correct and misleading information. In both situations, social behaviors affected the progression of epidemics. Collective actions, such as mask wearing and social distancing, became essential. Trust in science and effective health communication helped mitigate the spread. Reflect on these similarities. Historical and contemporary responses illustrate that fear often drives human actions. Understanding our past aids in navigating present crises. To wrap up, history reveals how epidemics shape societies. Our responses change, yet fundamental human reactions remain constant. Learning from history can refine our strategies today. In 1918, people faced not only the threat of the influenza virus but also the emotional burden it caused. Hospitals filled to capacity, and families often made heartbreaking choices while caring for sick loved ones remotely. This isolation deepened their fear, highlighting the human desire for connection during chaos. Public sentiment fluctuated. Some clung to hope, while others succumbed to despair. Nightly gatherings on porches evolved into comforting rituals, where families shared stories from a safe distance, reminding each other of resilience amid adversity. Community leaders worked diligently, advocating for clear messages to counter the rising misinformation. As public health officials battled to contain the virus, the emotional strain weighed heavily on each community member. Citizens formed groups to ensure compliance with health orders while attempting to protect their neighbors. Amid this turmoil, artists found inspiration, using their talents to document chaos and express their emotions. This blend of fear and creativity birthed powerful expressions, from haunting songs to poignant poetry, capturing the struggle of the human spirit during an overwhelming crisis. These artistic expressions not only offered solace but reinforced the idea that no one is alone in their suffering, cultivating a shared experience and unity amid the turmoil. The narratives emerging from this chaos were not only about loss, they celebrated the resilience of the human spirit. One remarkable instance involved a local nurse who, despite her fears, tirelessly attended to patients, embodying hope in her community. Her unwavering commitment inspired others to join the fight, highlighting the strength that surfaces during crises. This collective spirit became essential, emphasizing that even in darkness, people can rally together, drawing strength from one another to face challenges ahead. Historically, society has consistently demonstrated the power of human connection, revealing that even in the direst circumstances, compassion can prevail. Shared experiences forge bonds, enabling communities to endure, showcasing that humanity's core thrives strongest amid adversity. In examining these events, it's apparent that every epidemic compels society to reassess its values and priorities. People came to recognize the urgent need for robust health infrastructure and community support, which often fell short in crises. The cries for improved healthcare systems resonated within every affected nation, underscoring disparities in resources and access to care for marginalized communities. As nations struggled with inadequate responses, they recognized that investing in health equity is not merely a moral duty, it is essential for public safety. History repeatedly shows that vulnerable populations suffer most during emergencies, prompting calls for societal changes that transcend immediate threats. Activism surged as individuals acknowledged their power, advocating for equal access to medical care and promoting dialogues about mental health and emotional support. Collectively, societies redefined resilience, viewing it as empowerment and proactive engagement in health advocacy. In the face of despair, the resilience of the human spirit emerged as a guiding light. The local nurse's story echoed throughout communities, prompting more individuals to step forward, eager to help or provide comfort. Neighborhoods worldwide witnessed countless acts of kindness, from delivering groceries to the elderly to sewing masks for frontline workers. These gestures fostered renewed belonging, transforming fear into a collective drive for healing and recovery. Each small act of bravery tightened community bonds, demonstrating that solidarity can flourish even in hardship. Every individual became a crucial thread in the fabric of resistance against an unseen enemy, forging a legacy of perseverance that future generations would treasure. As this tapestry of resilience unfolded, it became clear that each epidemic's narrative was not solely marked by illness and loss. Communities began highlighting the immense strength drawn from cooperation and shared goals. Local initiatives blossomed as creative individuals organized art therapy workshops and community clean-ups, revitalizing once dormant spaces. Schools swiftly adapted, transitioning to online learning platforms that assured education continued despite uncertainty, providing semblances of normalcy for children and families. The proliferation of kindness illustrated a universal theme. In times of crisis, humanity unites, showcasing compassion that transcends divides. People of all ages collaborated, driven by an innate desire to uplift one another, serving meals at shelters and supporting those in distress. This culture of mutual aid steadily laid a foundation for recovery, reinforcing the idea that together individuals can navigate through darkness. A pivotal moment surfaced when community leaders realized storytelling's importance as a healing tool. They organized forums that encouraged individuals to share their experiences, allowing previously silenced voices to emerge. These gatherings became sanctuaries of understanding, where laughter mingled with tears, transforming shared pain into collective strength. Local artists and writers thrived in this environment, capturing their neighbors' lived experiences in heartfelt murals and poignant narratives. Each piece of art sparked fresh discussions about hope, loss, and resilience, compelling others to reflect on their journeys and interconnected lives. Gradually, a tapestry of narratives revealed communities' profound capacity to adapt and thrive. Through these stories, individuals rediscovered their humanity amidst struggle, reminding everyone that even in the darkest times, new perspectives can light the way forward. Healing flourished as empathy blossomed, forging connections that transcended previous boundaries and unveiling a unified front of compassion, courage, and a desire for better futures. Amid the challenges, communities turned toward local businesses facing their tribulations. Small shop owners, once fixated on profits, began to redirect their missions. Many provided free meals to healthcare workers, while others promoted local artists, showcasing creativity's power during crisis. These efforts not only offered crucial support but also built solidarity, demonstrating how diverse sectors could unite for a common cause. It became clear that mutual aid extended beyond individual acts. Thriving together meant recognizing lives' interconnectedness. The spirit of innovation flourished, facilitating new ideas, prioritizing community over competition. Collaborations emerged between artisans and manufacturers, producing essential protective equipment, underscoring ingenuity thriving under pressure. This transformation took root, reshaping local economies' fabric and redefining success as a communal victory. As each community discovered its rhythm, the insights derived from crises began inspiring future generations, ensuring that resilience and empathy's legacies would endure. Around the world, people realized the significance of their individual roles in crafting a cohesive response. Children stepped forward in unexpected ways, writing letters to healthcare workers and hosting virtual concerts to uplift spirits.